Next topic, the role of neurotransmitters in the control of gastrointestinal motility in detail with multiple points. So the control of gastrointestinal motility is a complex process that involves the coordinated activity of several neurotransmitters. Neurotransmitters are chemical messengers that are released by nerve cells to transmit signals to other cells. In the gastrointestinal tract, neurotransmitters play a crucial role in regulating the contraction and relaxation of smooth muscle cells, which are responsible for moving food through the digestive system. Some of the key neurotransmitters involved in the control of gastrointestinal motility are acetylcholine, is the primary neurotransmitter released by the parasympathetic nerve system, which stimulates smooth muscle contraction and promotes peristalsis. Acetylcholine also stimulates the release of digestive enzymes and promotes the relaxation of the pyloric sphincter, allowing food to move from the stomach to the small intestine. Then norepinephrine is released by the sympathetic nerve system, which inhibits smooth muscle contraction and slows down peristalsis. Norepinephrine also stimulates the contraction of the sphincter muscles such as pyloric sphincter, preventing the backward flow of food. Then serotonin. Serotonin is a neurotransmitter that is mainly synthesized in the enterochromaffin cells of the gastrointestinal mucosa. It plays a key role in regulating intestinal motility, where it promotes peristalsis and stimulates secretion of fluid and electrolytes. Then dopamine. Dopamine is mainly synthesized in the hypothalamus and it plays roles in regulating the activity of the gastrointestinal tract. Dopamine inhibits gastrointestinal motility and it is involved in the control of the vomiting reflex. Dopamine has influence in the vomiting reflex and also it controls and actually it inhibits the gastrointestinal motility. But serotonin regulates the gastrointestinal motility and peristalsis. Then the procedure of neurotransmitter release and its effects on gastrointestinal motility involves several steps. When food enters the stomach, the stretch receptors in the stomach wall are stimulated, which triggers the release of acetylcholine by the parasympathetic nerve system. Acetylcholine then stimulates the contraction of the smooth muscle cells in the stomach wall, promoting peristalsis and the mixing of food with gastric juices. As food moves into the small intestine, the release of ACH is stimulated by the presence of fatty acids and amino acids, which promote the release of the hormone cholecystokinin from the intestinal mucosa. Cholecystokinin then stimulates the release of ACH, which promotes the contraction of the smooth muscle cells in the intestinal wall and the movement of food through the small intestine. Norepinephrine is released by the sympathetic nerve system in response to stress or the fight or flight response, inhibiting gastrointestinal motility and slowing down peristalsis. Serotonin and dopamine are also involved in the regulation of gastrointestinal motility, with serotonin promoting peristalsis and dopamine inhibiting it. In summary, the control of gastrointestinal motility is a complex process and that involves coordinated activity of several neurotransmitters. Acetylcholine and serotonin promote peristalsis and the contraction of smooth muscle cells, while norepinephrine and dopamine inhibit gastrointestinal motility and slow down peristalsis. The release of these neurotransmitters is regulated by the parasympathetic and sympathetic nerve systems and is influenced by the presence of hormones and other signaling molecules. Then energy balance. Energy balance refers to the equilibrium between energy intake from food and the energy expended by the body. It is an important aspect of maintaining overall health and preventing various chronic diseases. The energy balance equation can be expressed as energy intake is equal to energy expenditure plus energy stored. When the energy intake exceeds the energy expenditure, the excess energy is stored in the body as fat, leading to body weight gain and obesity. On the other hand, when energy expenditure exceeds the energy intake, the body uses stored energy, resulting in weight loss. Major points of energy balance include energy intake. This refers to the total amount of calories consumed from food and beverages. The macronutrient composition of the diet also plays a role in energy balance, as each macronutrient has a different calorie value. For example, 1 gram of carbohydrate and protein provide 4 calories each, while 1 gram of fat provide 9 calories. Then energy expenditure, this refers to the total amount of calories burnt by the body through physical activity and metabolic processes. Energy expenditure is influenced by various factors including age, gender, and body composition, physical activity levels, and basal metabolic rate. Then, energy stored. This energy refers to the energy that is stored in the body as fat or glycogen. Energy stored can be influenced by the balance between energy intake and expenditure. The procedure for maintaining energy balance include tracking food intake. This involves keeping track of the number of calories consumed through food and beverages. This can be done through food diaries, tracking apps, or consulting a registered dietitian. Increasing physical activity. This involves engaging in regular physical activity to increase energy expenditure. This can include activities such as brisk walking, jogging, weight lifting, and other forms of exercise. Then, balancing macronutrient intake. This involves consuming a balanced diet that includes a mix of carbohydrates, protein, and fat in appropriate proportions. Then, multiple examples of maintaining energy balance include eating a balanced diet that include whole grains, lean protein, fruits, and vegetables, engaging in regular physical activity such as walking, jogging, or swimming, monitoring portion sizes and avoiding overeating, limiting high calorie foods such as sugary drinks, processed snacks, and fried foods, maintaining energy balance. Energy balance is important for overall health and can help prevent caloric diseases such as obesity, diabetes, and heart disease. It is important to maintain a healthy balance between energy intake and expenditure by consuming a balanced diet and engaging in regular physical activity. Energy balance. Energy balance refers to the relationship between energy intake, calories consumed, and energy expenditure, calories burnt, over a period of time. When energy intake and expenditure are in balance, the body maintains a stable weight. When energy intake exceeds energy expenditure, the body stores the excess energy as fat, leading to weight gain. On the other hand, when energy expenditure exceeds energy intake, the body burns stored energy or fat to meet its energy needs, resulting in weight loss. The major points of energy balance include energy intake. This refers to the amount of energy measured in calories obtained from the food and drinks we consume. The energy content of food is determined by the amount of macronutrients, carbohydrates, proteins, and fats they contain. Carbohydrates and protein provide about 4 calories per gram, while fat provides about 9 calories per gram. Energy expenditure refers to the amount of energy used by the body to maintain its basic functions like basic metabolic rate, perform physical activity, and digest food. Thermic effect of food. Physical activity is the most variable component of energy expenditure and includes both structural exercise such as running or weightlifting and everyday activities like cooking and housework. Then, energy storage. When the body consumes more energy than it expends, when the body consumes more energy than it expends the excess energy stored as fat. The amount of fat stored depends on the size of the energy surplus and the individual's metabolic rate. The following are some key factors that affect energy balance. Genetics. Genetics plays a role in determining an individual's metabolic rate, which can affect energy expenditure and energy storage. As we age, our metabolism slows down and we tend to lose muscle mass, which decreases energy expenditure. Hormones. Hormones such as insulin, cortisol, and leptin can affect energy expenditure and intake, as well as the body's use of stored energy. The diet. The macronutrient composition of the diet can affect energy intake and expenditure. For example, high fat diets can lead to overconsumption and weight gain. Physical activity. Regular physical activity can increase energy expenditure, leading to weight loss and improved metabolic health. To maintain energy balance and prevent weight gain, it is important to consume a balanced diet, engage in regular physical activity, and monitor portion sizes. By making healthy lifestyle choices, individuals can achieve and maintain a healthy weight, which can reduce the risk of chronic diseases such as diabetes, heart diseases, and certain types of cancer. Obesity. Obesity is a condition characterized by an excessive accumulation of body fat, which can lead to a range of health problems. The causes of obesity are malfunctional, involves a combination of genetic, environmental, and behavioral factors. Here are some of the major causes. Genetic researchers has shown that the genetics can play a role in obesity. Certain genetic mutations or variations can affect metabolism, appetite regulation, and the body's response to physical activity, all of which can contribute to weight gain and obesity. Then overeating, consuming more calories than the body needs, can lead to weight gain and obesity. Overeating can be caused by a variety of factors such as stress, boredom, or the availability of high calorie, low nutrient foods. Lack of physical activity. Sedentary lifestyles can lead to a decrease in energy expenditure, which can contribute to weight gain and obesity. Many factors can contribute to a lack of physical activity, including desk jobs, long commutes, and the availability of technology that makes tasks more convenient. Next, medical conditions. Certain medical conditions can contribute to weight gain and obesity, like the hypothyroidism, Cushing's syndrome, and polycystic ovary syndrome (PCOS). Medication. Some medications can cause weight gain as a side effect, such as antidepressants, antipsychotics, and certain diabetic medications. Sleep deprivation. Lack of sleep has been linked to weight gain and obesity, possibly due to changes in hormone levels that regulate appetite and metabolism. Environmental factors. Environmental factors such as the availability of high calorie, low nutrient foods and the prevalence of sedentary lifestyles can contribute to obesity. Psychological factors such as stress, anxiety, and depression can contribute to overeating and weight gain. Socio-economic factor. Lower income individuals may have less access to healthy foods and opportunities for physical activity, which can contribute to weight gain and obesity. Cultural factors. Cultural factors such as food preferences and eating habits can contribute to weight gain and obesity. Obesity is associated with a range of health problems including type 2 diabetes, heart disease, stroke, high blood pressure, and certain types of cancer. Managing obesity often involves a combination of dietary changes, physical activity, and behavioral therapy, and in some cases, medication or surgery may be recommended. Consequences of obesity. Obesity can have a range of negative consequences on an individual's physical and mental health. Here are some of the consequences of obesity. Type 2 diabetes. Obesity increases the risk of developing type 2 diabetes, a condition in which the body is unable to use insulin properly, leading to high blood sugar levels. This can lead to a range of complications including nerve damage, kidney damage, and blindness. Cardiovascular diseases. Obesity increases the risk of developing cardiovascular diseases, including heart diseases and stroke. This is due to the increased strain of the heart and blood vessels, as well as the presence of other risk factors like the high blood pressure and high cholesterol. Then, respiratory problems. Obesity can lead to respiratory problems, including sleep apnea, a condition in which breathing is interrupted during sleep, and asthma. Joint problems. The excess weight carried by individuals with obesity can put a strain on the joints, leading to joint pain and arthritis. Then, digestive problems. Obesity can increase the risk of developing digestive problems such as gastroesophageal reflux disease and gallbladder disease. Cancer. Obesity is associated with an increased risk of developing certain types of cancer, including breast, colon, and pancreatic cancer. Mental health problems. Obesity is associated with an increased risk of developing mental health problems, including depression, anxiety, and low self esteem. Then, fertility problems. Obesity can lead to fertility problems in both men and women, including polycystic ovary syndrome in women and erectile dysfunction in men. Then, liver disease. Obesity increases the risk of developing non alcoholic fatty liver disease, the condition in which excess fat accumulates in the liver. Skin problems. Obesity is associated with an increased risk of developing skin problems, including stretch marks and skin infections. Overall, the consequences of obesity can have a significant impact on an individual's quality of life and overall health. Preventing and managing obesity through lifestyle changes such as diet and exercise, as well as medical interventions, when necessary, can help to reduce the risk of these negative consequences. Methods to cure obesity. There are several methods that can be used to treat obesity, including diet and exercise, A healthy diet combined with regular physical activity is a proven method for weight loss and its management. This can include reducing calorie intake, increasing the consumption of nutrient dense foods, and engaging in moderate to vigorous exercise. Then, behavioral therapy. This type of therapy can help individuals to develop healthy eating habits and to overcome emotional and psychological barriers to weight loss. Then, medications. Certain medications can be prescribed to help individuals lose weight or to manage weight related health conditions like the diabetes and high blood pressure. However, this medication should only be used when with the guidance of a healthcare professional. Then, bariatric surgery. This is a surgical procedure that is used to help individuals with severe obesity to lose weight. Types of bariatric surgery include gastric bypass, gastric sleeve, and gastric banding. Lifestyle interventions. These interventions can introduce and include problems that provide education, support, and counseling to help individuals take healthy lifestyle changes. Then, support groups. Support groups can provide individuals with social and emotional support as well as strategies for managing weight loss. It is important to note that the best approach to treating obesity will vary depending on the individual's unique needs and circumstances. A healthcare professional can help to determine the most appropriate treatment plan based on an individual's weight, health, and other factors. Types of obesity. Obesity can be classified into several types based on its underlying causes and medical conditions associated with it. Here are some of the types of obesity and how they can be treated. Simple obesity. Simple obesity is the most common type of obesity where excess body fat accumulates due to combination of genetic and environmental factors including poor dietary habits and lack of physical activity. The treatment for simple obesity involves a combination of lifestyle changes such as following a healthy diet and engaging in regular exercise. Then metabolic obesity. Metabolic obesity occurs when hormonal imbalances disrupt the body's metabolism, leading to excessive weight gain. This type of obesity is associated with medical conditions like diabetes, thyroid disorders, and Cushing's syndrome. The treatment for metabolic obesity involves managing the underlying medical conditions with medications and lifestyle modifications such as following, following a healthy diet and engaging in regular exercise. Then hypothalamic obesity. Hypothalamic obesity is caused by damage to the hypothalamus, a part of the brain that controls appetite and metabolism. This type of obesity is usually associated with medical conditions such as brain tumors, head injuries, and genetic disorders. The treatment for hypothalamic obesity may involve medications to control appetite and metabolism, and in some cases, surgery may be necessary to remove the tumor or repair the damages to the hypothalamus. Cushing's syndrome. Cushing's syndrome is a medical condition characterized by excessive production of the hormone cortisol. This can lead to excessive weight gain, especially around the face and abdomen. Treatment for Cushing's syndrome involves addressing the underlying medical conditions with medication, surgery, and radiation therapy. Then Prader-Willi syndrome. Prader-Willi syndrome is a genetic disorder that affects the hypothalamus and leads to uncontrolled hunger and excessive weight gain. The treatment of Prader-Willi syndrome involves the combination of medication and behavioral therapy to help individuals control their appetite and develop healthy eating habits. Obesity due to medication. Certain medications such as antidepressants, steroids, and antipsychotics can cause weight gain as a side effect. Treatment for obesity due to medication involves either switching into a different medication or managing the side effects with a healthy diet and regular exercise. It is important to note that the treatment for obesity should be individualized based on the underlying causes and the individual's unique needs and circumstances. A healthcare professional can help to determine the most appropriate treatment plan based on an individual's weight, health, and other factors. BMR. BMR stands for basal metabolic rate, which refers to the minimum amount of energy or calories that an individual's body requires to carry out basic functions while at rest, such as breathing, circulation, and cellular respiration. BMR accounts for up to 70% of an individual's total energy expenditure. Factors that can influence BMR include age, gender, body composition, genetics, and hormonal imbalances. Generally, males have a higher BMR than females due to higher muscle mass, and people age their BMR tend to decrease. There are various methods used to measure BMR, including direct calorimetry, which involves measuring the amount of oxygen consumed and carbon dioxide produced by the body. Other methods include bioelectrical impedance analysis, dual energy X-ray absorptiometry, and predictive equations based on factors such as height, weight, and age. BMR plays an important role in weight management as it determines the number of calories an individual needs to consume daily to maintain their weight. Consuming more calories than the BMR can lead to weight gain, while consuming fewer calories can lead to weight loss. Therefore, knowing one's BMR can help in designing a personalized diet and exercise plan to achieve weight goals. BMR, or basal metabolic rate, refers to the minimum amount of energy or calories that the body requires to carry out basic functions while at rest. It is an important parameter that determines the number of calories required to maintain the body's normal functions and plays a crucial role in weight management. BMR accounts for up to 70% of an individual's total energy expenditure, which is the amount of energy required to carry out various activities such as digestion, physical activity, and metabolic process. BMR is influenced by several factors such as age, gender, body composition, and genetics and hormonal imbalances. Generally, males have high BMR than females due to higher muscle mass, and as people age, their BMR tend to decrease. Measuring BMR can be done through indirect calorimetry, which involves measuring the amount of oxygen consumed and carbon dioxide produced by the body. Other methods include bioelectrical impedance analysis, dual energy X-ray absorptiometry, and predictive equations based on factors such as height, weight, and age. BMR plays a major important role in the weight management. Consuming more calories than the BMR can lead to weight gain, while consuming fewer calories can lead to weight loss. Therefore, knowing one's BMR can help in designing a personalized diet and exercise plan to achieve weight goals. In addition to weight management, BMR also plays a role in medical diagnosis and treatment. Certain medical conditions such as hypothyroidism can lead to a decreased BMR, while hyperthyroidism can lead to an increased BMR. Measuring BMR can help in the diagnostic and purpose and measurement of such conditions. In conclusion, BMR is an important parameter that determines the minimum amount of energy required to carry out basic functions while at rest. Measuring BMR can help in designing a personalized diet and exercise plan for weight management and in the diagnostic and purpose and measurement of medical conditions. Basal metabolic rate is a minimum amount of energy required to maintain essential body functions while at rest. This includes the energy required for breathing, circulation, and cell production. BMR varies based on factors such as age, gender, body composition, and genetics. Understanding BMR is important for maintaining a healthy weight and developing a healthy lifestyle. In this essay, we will discuss the significance of BMR and how to calculate it. Significance of BMR, weight management. Then, exercise planning. Knowing your BMR can also help you plan your exercise routine. The energy required for physical activity is added to the BMR, resulting in the total daily energy expenditure. A balanced exercise routine combined with a healthy diet can help you maintain your weight and improve your overall health. Then, health conditions. BMR can also be used to diagnose certain health conditions such as thyroid disorders. A low BMR may indicate hypothyroidism, while a high BMR may indicate hyperthyroidism. Calculation of BMR. The Harris-Benedict equation is commonly used to calculate BMR. This equation takes into account age, gender, weight, and height. The formula is as follows. BMR is equal to 88.36 plus 13.4 into weight in kilogram plus 4.8 into height in centimeter minus 5.7 into age in years. For female or women, we can see BMR is equal to 447.6 plus 9.2 into weight in kilogram plus 3.1 into weight in centimeter minus 4.3 into age in years. Once you calculate your BMR, You can use it to determine your daily calorie needs based on your activity level. To lose weight, you need to create a calorie deficit by consuming fewer calories than your BMR. In conclusion, BMR is an essential factor to consider when it comes to weight management and overall health. Understanding your BMR can help you plan your diet, exercise routine, and lifestyle to achieve your health goals. By calculating your BMR and using it to determine your daily calorie needs, you can maintain a healthy weight and improve your overall health. So, with the help of this last video, we have completed the quick summary of this nutrition chapter. And thank you for listening.